Hello, everyone. Thank you so much for joining us today for the Utah Housing Coalition monthly meeting. It is June 1st. Today, we will cover two topics related to housing. My name is Francisca Blanc, and I would like to introduce our first facilitator, Sherri Whittwer. She is a mental health advocate and also the vice chair of the Utah Housing Coalition. Welcome, Sherri.
Thank you. It's great to be here. Thank you, everyone, for joining us. This is an exciting topic, something we have been waiting for a long time. And so I'm very happy to introduce Christine Nguyen, who is a Medicaid state level housing coordinator. Hopefully I got that right, Chris. But with that, we just want to turn the time over to you and have you fill us in on the latest details with this.
Great, thank you so much. I really appreciate Francisca and Tara inviting me to be here today. This is something that we at the Department of Health and Medicaid Services have been looking forward to for quite a long period of time. Many of you have worked on this off and on with us for more than a year and a half, 2 years, going back to CMS, creating something that we think will be beneficial for the people that we all serve. I'm going to share my screen. I just have a very short overview of, did I go away or is everything okay?
Everything is okay. Oops, I think we lost her. Okay, she's coming back.
I'm so sorry. I don't know what happened.
That's okay, no worries.
I don't know if my screen is shared or not, but here I am.
Yeah, if you like to try to share your screen one more time.
Okay, I will do that. Okay, share. Is it doing the right thing?
Yes.
Okay, great. Once again, thank you for inviting me to be here. I am with the Department of Health, which will soon be the Department of Health and Human Services. July 1, we're rolling all of that out. We're working diligently to become one department right now. And so I appreciate all of you that are going on this journey with us as well. What the housing related services and supports piece of the 1115 waiver is really designed to do is to augment community services for our TAM population. And I know those of you that work with Medicaid regularly know that that stands for Targeted Adult Medicaid Populations, inclusive of ages 19 through 64. Each participant that does take advantage of the housing related services and supports must meet at least one of the needs-based criteria and one risk factor, but those that are a part of our TAM population already are qualified for that. And that's the reason that I wanted to just let you look at this draft document of the general overview, because it does list the basic needs criteria for those of you that might have questions about this. The reason that we're so thrilled about this is that we know that oftentimes those of you that provide services in the community have housing options for the individuals you serve, but you don't have the funding to provide additional services, case management, move-in expenses, those sorts of. So we are absolutely thrilled to be able to roll out this new program that hopefully will be nothing but a positive in everyone's work life and for those that we serve. We are really working diligently to plan for an early fall rollout. We know that you've been waiting a long time, and that's why we don't want to hold things up unnecessarily. We are currently working to complete the draft of our provider manual. We are working to have an online presence so that you will be able to look at everything, look at all of the requirements, do all of those sorts of exploratory types of things regarding the program in a web-based setting. And we know that we are going to be changing things as we move along in this process. So the way that this rolls out, initially, we are doing the best we can to meet all your needs, but what we really want is a future of you making recommendations and helping us provide improvements to the way this program is administered. And, we know that you all know, this is a federal program. Federal programs come with lots of complicating criteria, and we are trying to make that as less burdensome as we possibly can. And we are going to roll out something that we hope is at least a beginning, but we do want to keep all of our service providers in the loop. We want you to connect with us when you have questions. We recently are completing hiring for a new position, which will be the person that does assist with all of the payments and the policies and procedures and all of the things that will make this ultimately be a smooth billing process for all of you. We know many of you have never billed Medicaid, and those of you that have not done it outside of the mental health focus area. So we really want to work with everyone to make this a process that is learnable, doable, and gets easier over time. We want open communication, and we just really want to be a good partner to all of you. If you have any questions, I'm happy to try to answer some. I do not know everything about Medicaid. I'm the housing coordinator, so those are the areas that I, most often travel in. But if you have questions I cannot answer, I'm happy to connect with the experts that would be able to give an answer.
Chris, thank you for this overview. And again, this is a project that has been years in the making, and we really think this will have a significant impact on the service delivery system and capabilities. What are the practical ways that you see this can really help our service delivery system?
Well, I think the things that I personally am more thrilled about are the ways that it can assist the individual with actually paying for applications. And, while this program can't do first and last month's rent, it can do, the other, like, for example, utility turn-ons and maybe the first month of utility payment, if they need a specialized bed or they don't have funding for a couch or a kitchen table. I mean, it will be up to their case manager which of the available pieces of the program they want to utilize, which would be the most helpful to them. But I just know that it is so difficult often for somebody to even pay for the application fee. So if we can step in and do that right from the start and then help them get established, that is a huge benefit, I believe, to most of the people that we are going to be focusing on, but also the ongoing supports with case management. It's not to be underestimated how critically important the long-term success of stable housing, relies on case management. So it's hard to know which to be the most thrilled about, but I'm really excited that people can actually apply and get into a housing situation, but then the fact that they will have people that can, pave the way for them to be successful long term is also amazing. So
yeah, these are all things that community providers have been bumping up against for years, and just things not traditionally covered by Medicaid that really will make a huge difference. Case management is always just such a huge need.
Right.
So the state has borrowed ideas from other states. There are other states that have done this.
Yes, and they have really seen a lot of success. Tanya and her team, during the 1115 waiver request process, really worked closely with other states, and were able to incorporate the ideas that they felt worked best for them. And of course, we were able to connect with all of our service providers. A long time ago, pre-COVID days, we had a huge meeting with, many of the providers that are probably on this call. Sherri, I know that you were with us in that meeting. There were at least, I believe, 35 to 50 providers in the room giving us suggestions and ideas. And those are the things that we really incorporated into this request. And that's why this looks so much like what everyone needs, because all of you let us know what the needs were. And then we worked with other states to see how those needs were addressed and how they were approved, through CMS, and that's how we designed our request. So, we're hoping this is pretty encompassing of what everyone had in mind in those long ago, but not forgotten meetings that we all attended.
Well, again, the process involving so many community providers hopefully yields a much better product. And so we're excited about that. Can you repeat again what the timeline is for rollout of this? And
well, we want to, under promise and over deliver. So we are saying fall. If anything happens prior to that, you will all be the first to know. And we really are on the downhill slide towards something beginning, but we also really want to ensure that whatever everyone knows, that what we roll out in the beginning hopefully will work well enough to get us started, but that we really do want to continue to take suggestions, make improvements. We're thinking that a year from our rollout may look a lot different than what it looks like originally. And so I've included my email on this overview draft document. And I want all of you to save it. And as things roll out and things happen, comments, suggestions, please send them to me at any time. And if you have questions now, please email me this afternoon or tomorrow, whatever you would like to do, and I will try to find answers for you.
That's great. Do we have any questions right now, Francisca?
Yes, we have a couple of them actually in the chat. So I'm going to start. Let's see. Actually, one is more like a comment. The other one is a question. So if they are on Medicaid and getting Y funds from DWS for support services, can they still receive the support services from this program as well?
If they are a TAM participant. And I don't know what they mean by Y. What
maybe
is that?
maybe just a misspell, because sometimes it's hard to type in the chat. But I guess if the person is on Medicaid and getting funds from DWS for support services, can they still receive help from this program as well, the new program?
This is for housing related services. So if they are receiving Medicaid services for a mental health issue or for something separate than housing, then yes, the answer is yes. This is housing focus. So they can be going to other case managers for other concerns, but this is a housing focused program. So I believe the answer to that would be yes. It would be, a personal, we would go through the person's, package, but this housing related services and supports is housing focused, and it doesn't supersede or, compete with any other case management.
So here's a one question in Q&A, and I'm not sure if you're going to be able to answer it, but the person asked, I see that the program will not cover rent itself. What are the resources available to help to pay rent? So,
well, I mean, we know that receiving a voucher helps to pay rent. If you live in a tax credit apartment unit, that helps to pay rent. Medicaid can never, ever pay rent, unfortunately. But they can pay for the things that get people into the housing. And there's not any kind of rule that they can't share a living situation with roommates or do anything along those lines. That is, approved. And, as long as the case manager that's working with the person, is helping them locate an affordable living situation, we're just never able to pay rent. And, I think we tried to ask about first and last months. We tried, every time we asked about anything that was rental assistance, the answer was a definite no. So we've asked for every single thing that Medicaid can possibly pay for in housing related services and supports. And, rent is just definitely not one of them.
Yes, so that's our next project, is to look for more resources that way. No question,
Right.
that's important.
Yes, and I mean, we all know that even when people have a voucher in this current housing situation, they're getting extensions, and they still can't find vacancies. So, you know, while this is exciting, it still makes me cautious because I know we don't have living situations. People that have lots and lots of money can't find a place to live, let alone people that, you know, are limited. So, you know, we know that this isn't a total solution, but we are hopeful that it moves the needle a bit.
Absolutely.
So I'm sorry, Sherri. We have one last question because I want to make sure we stay on time. And Christine, how will you determine the number of case managers required?
Well, that will be up to the service providers, I believe. We are not going to be micromanaging this, you know, in any way. I would assume that a person wouldn't need more than one case manager focused on housing, but I don't know. They might. I mean, they might need someone to help them do a housing search, someone to, you know, talk with them about work and making money and filling out applications. I mean, this is going to be up to the service providers to spend the money that each person is allowed in any way they see the most bang for the housing situation, right? So we aren't saying you can have 6 or 2 or 1. You can utilize this service in the way the service provider believes this person will be best served.
Well, thank you so much for sharing your knowledge and years of work with us. And we really are excited to see how this folds out, and appreciate the offer to have an ongoing conversation and provide feedback in that process. So
Right. Thank you, Sherri. And I just really appreciate Francisca the invitation again. So thank you, and please connect with me, anyone that would like to or needs to. And we hope to have good news very soon on the horizon.
thank you so much.
Thank you so much, Christine, and thank you, Sherri. Christine, when you have a minute, if you like to put your email in the chat, a lot of times people just grab it from there. I
Okay.
appreciate both of you. So now we're gonna go to our second session of our meeting, and I'm gonna let my colleague Gehemi do the proper introductions. Thank you.
Thank you so much, Franchi. And hello, everyone. My name is Jakey Siolo. I am the project manager here at the Utah Housing Coalition. My pronouns are they, them. And today I am going to introduce you amazing people who works in the field as myself. And with us, we have today Jakey Siolo, which is a housing case manager from the Pacific Islander Knowledge to Action Resources. And we also have the CEO, Susi Feltch-Malohifo'ou. Susi, I practiced 6 times and I still didn't do it. I apologize for it publicly. And then we have Lauren Littlefield from Housing Stability and Recovery from the Soleil County. And we're going to talk a little bit about the impact and the importance of community health workers during the pandemic on the housing world. And so I am going to open the discussion and I am going to, let Jake to introduce himself as well and to talk about what he does at Pictar.
Did you say my name? Yeah. Okay.
Jakey, yes.
Hi, everybody. My name is Jakey Siolo. My pronouns are he, they. I'm here with Susi, my boss. But yeah, I am the case management coordinator with Pictar. I kind of just, we didn't really, I think like August of last year is when all of my caseloads began to be just strictly housing. And so that's really kind of what I've been doing with Pictar. So kind of if anybody needs housing, I usually help them with that. And then I'm also the director of our Nua collective, which is our LGBTQ group. But yeah, that's a little bit about me. I'll have Susi go.
Thank you. And thank you for the opportunity to be here this morning to talk about this really serious issue that we have in our city. Just to give some people background about Pictar, we are a community-powered, ethnic-based 501c3 nonprofit that originally was created to service Pacific Islanders. However, currently we are a multicultural service provider. And one of Pictar's case management services values is that we provide a no barrier services. And I'm really proud to say that we're not the agency that passes the buck, but the buck stops with us. We're 24/7 in language direct services when needed. And so we have a team in our Empowered Living Services Department that are our direct service community health workers. And many of you know that community health workers come with many different hats and many different titles. And so case management is one of those hats that case managers or that CHWs use. But we are the trusted service providers to connect and assist community members to empowering resources. I would say that one of the things that ethnic community-based organizations are used to is to work with no money. And that we are resourceful. We have to be resourceful if we're going to help. We are not the United Way with lots of money and lots of capabilities. And so luckily, we have built relationships with government agencies and with foundations and pieced together how we're going to be able to help with housing. And like Jakey said, it became an issue and really all of his cases became housing. And I mean, I'm excited to hear that we're going to be able to bill in Medicaid. I do see some issues though, is that for programming and monies for programming, I can see that this is going to be really great. But for the administrative side, for small ethnic-based organizations, how do we survive? Because there's not money for administration. How do we get to be able to bill Medicaid? So those are one, just Christine, as you were talking, is how do we be able to partake of this resource when we know that it takes a lot to be able to bill Medicaid? And is there going to be technical assistance for us to be able to do that for agencies? So that's my first thought. But
right.
The housing thing is very concerning, and how we got involved with it is because somebody may come to us with domestic violence. Somebody may come to us because they need help with employment. But if you don't have a roof over your head, you have to start there. You have to start with the basics. Do the people have a roof over their head? Do they have food on the table? Do they have is their health good? If you can take care of those three things, then we can work on the other things. And I think that that's how we started in our case management style and process, is we always go back to the basics first. So somebody can come to us with a need, but we're always going to check that first. If you are stressed out, mentally stressed out because you don't know where you're going to lay your head down at night, and you don't know where your kids are going to sleep, that supersedes all of these other things in my mind and in the values that we have put together in Empowered Living Services. I think you know, I wish that we had one piece of paper that had all of the resources, because there are a ton here in Utah. I've worked in 3 different states, and honestly, Utah has some great resources, but it seems like the left doesn't know what the right is doing. And that across the board, you know, the ethnic-based organizations and the ones that are doing grassroots, we're the ones that see and hear first. We can tell you what's going on before government agencies have to have the data and the money aligned to be able to help us. But what happens in that 4 or 5 years? How many families are not serviced? That's where community health workers, that's where community-powered organizations, that is our value in that space. Then the idea is then the big box nonprofits can help out, or we can hand over. But I don't know if I've gone on a tangent here, but you know, for housing, Yohemi, please jump in if there's any questions. But I feel like we can do better and just systemically helping us, because as I can see, this is a great program for Medicaid, but I can also see that agencies like ourselves and many others that are the trusted voice, that are the people that are doing the service providing for the most vulnerable, will be kept out of this process because we aren't set up to bill Medicaid. I don't even know how to do that. Is someone going to help us do that? I hear that it takes 1 or 2 years to be able to do that. So those are my thoughts about housing, and open to any questions, Yohemi.
Actually, you respond the first question I had, which was
great.
why. And I think that you did a great job. And, you know, I want to bring this to both your attention, to you and to the Christine one. Our executive director said something that, you know, it always sticks with me. Our members are the ones who know what is happening, and we connect. That's our job. And so I would love to connect you with Christine, you know, because we are the experts, right? The members are the experts, community health workers are the experts. And sometimes we just need to, you know, as organizations, we need to connect you with the right person. And I think that right now we have the right person with us. And so I will make sure that I will connect you, Susi, with Christine. And I do want to introduce Lauren, if it's okay. Lauren is from Salt Lake County, and I am going to let her introduce herself.
Hello,
Hey,
good morning or good afternoon.
Lauren, can I jump in here for just a second?
Sure.
I just want to say that Lauren is one of those partners of ours, and just grateful for the work that she has done to help our communities. I just checked with the young lady that works with Lauren, and she just told me that we've serviced the last few months 20 families, provided $82,000 of rental assistance. $23,000 of that was to avoid 3-day paid back rent. So before Lauren starts, I want to say thank you to Lauren for helping us in providing these services. And again, what I was saying is knowing your resources out there, but Lauren is amazing, the program that they're doing, and can't thank her enough for teaching us, because like you said, we don't know what we're doing. We make mistakes, and Lauren's always there to help us through this process. So reach out to Lauren, learn about what they've got available, because it really does help our communities. So I just wanted to give you an advertisement before you started.
Well, thanks, Susie. Geez, I don't even think I need to say anything now. So I'm Lauren. I'm the housing stability and recovery manager. Really, that title just means I'm running the emergency rental assistance program, which is provided through 2 different funding sources. The first was the Consolidated Appropriations Act of 2020, which was the last kind of stimulus package passed during the Trump administration. And then also a second tranche of funding funded through the American Rescue Plan, which was President Biden's first stimulus project. So within Salt Lake County, we were originally allocated about $60 million in emergency rental assistance just for our county. That doesn't include the funds that the state of Utah and Salt Lake City, as well as Davis County, Utah County, and Weber County were allocated for those as well. I'm going to share my screen because I'm a big relier on PowerPoint. So sorry about that. So I should put it in view mode so it looks prettier since we're in front of the people. Is that a thing? No, oh well. Okay, quick overview. Emergency rental assistance funds can be used for rent, both current and arrears, utilities, both current and arrears, security deposits, and then other housing kind of costs. So for example, if someone's, internet or, gas or electric, whatever is included in their, in their rent, then these funds can be used to pay for those as well. One of the things that was really important to us at the county in this program is exactly what Susie was sort of talking about, is making sure that these funds were getting into the communities that have been disproportionately affected by COVID-19. So in order to do that, we really wanted to lift up the organizations like PICTAR, who are doing the grassroots work, on the ground in the communities, but also to leverage those trusted relationships. It's a lot more impactful for Susie to talk to someone who's affiliated with her organization somehow about emergency rental assistance than some random, girl from a government organization, which, can create some fear and some like, what is happening here? So we, in 2021, partnered with 21 community-based organizations to provide outreach and education about the programs and the funds that were available, and then also to provide assistance with the actual application process. The application process for these funds is both simple and arduous at exactly the same time. And so these 21 organizations, I think almost 1,200 applications were submitted, kind of through our organizations, which was really helpful, but I'll show a graph in just a few minutes, but really the goal was to make sure that these funds were getting into these disproportionately impacted communities. And we absolutely have data to show that has been the case. Along with outreach, education, and application assistance, we've really tried to start zeroing in and focusing on eviction prevention. Over the last really 6-7 months, we've seen those eviction numbers rise back to their pre-pandemic levels. And seems like a little bit of a disconnect. To date, there's been $103.5 million in emergency rental assistance that's gone out just into Salt Lake County alone. So we've been spending about $1 million to $1.5 million every week in emergency rental assistance for almost 15 months. So there's a huge problem. My boss says it best. The pandemic rung the bell and really shined a light on the huge problem that is housing instability, and you can't unring the bell. Now we see it and it's right there, and so we need to start dealing with it and doing what we can. Just sort of some stats about the program as it is now. In 2021, there was just under $62 million in rental assistance within Salt Lake County. Just this year, we're at $41 million, getting us to that 103 kind of overall. It's interesting, we see that women, female heads of household, are applying for these kind of overwhelmingly. So it's sort of like surprising, but not surprising. I think there's a narrative, certainly that says that women were disproportionately impacted by the pandemic. And this is one of those data points that's kind of proving that and showing the recovery. We're seeing that our seniors are not accessing these funds. And I think that's due to a couple of things. One, I think, the application is an online application, which is both great and terrible all at the same time, but you can really see the drop off after, the kind of the age of 50. We see the age of our applicants really take a nosedive. So that's something that we're looking at. How can we make sure that we're doing more outreach to our senior population in addition to the others? And we can see that the applications, the people who are applying very, very closely matches the demographic of our county. There's not, one single kind of population that's applying in kind of, mass numbers. And then as far as the geographic distribution, the darker zip codes are the zip codes where we see the most applications. And those have been the same since March 15th of 2021. That's central part of Salt Lake County, and then that northwest quadrant of Salt Lake City. Those are staying pretty standard. We really wanted to power this program by people. The programs in a lot of other states have been, we got this huge tranche of funds to help with emergency rental assistance, and we're going to find a consultant group to kind of run the program. In the state of Utah, we created a partnership with the state of Utah Department of Workforce Services with our local CAPs, our community action programs, and then with the grantees of the program. So Salt Lake County, Salt Lake City. And we noticed that during the early days of the pandemic, there was a lot of different organizations who were providing rental assistance, which was so incredible because there wasn't one central program. Everyone was just like, oh my gosh, we need help paying people's rent. Let's figure out how to do this. And there was a lot of different places that people could go to apply for that assistance. So we decided for this big program to create one single application portal and partner together on that. And so that's the process that we went through as far as the actual direct assistance goes. About 10% of the funds are available to use for administrative costs. And we at the county have taken those administrative costs and turned them into community grant programs. That's the largest pocket of funding. Myself and a fiscal coordinator are the only staff people that are paid from the county. So 90% of our budget goes to grant programs and helping community-based organizations help the communities that they serve. So like I said, in 2021, we contracted with 21 different organizations to provide that education and outreach. And what we found was that wasn't actually enough. We were getting constant outrage, especially from the Salt Lake County Health Department and the community health workers that were brought on during the pandemic to do things like contact tracing. A huge bulk of what those folks ended up working on was helping people find housing. Someone's infected with COVID-19 and they don't have a place to stay in the middle of a pandemic. That's a huge problem. And it's amazing how community health workers stepped up and really entered it into a space that I don't think they were ever anticipating being put into. So we worked with Holy Cross Ministries. We worked with the Salt Lake County Health Department to train community health workers how to help people apply for these funds, in addition to the 21 organizations that we worked with last year. These organizations are bridging all sorts of barriers, language barriers, technology barriers. I think in 2021, between our organizations, I think there was around 19 different languages that we had accessible. So if someone reached out to PICTAR, for example, and, they didn't have access to something, we could, help partner with the Asian Association of Utah to make sure that we can find, an interpreter so that people can get the help that they need. This is just a graph to show that we were successful in reaching our disproportionately impacted communities. The blue bars are our community partners. Those are applications helped fill out by organizations like PICTAR. The red bars are just people who applied for these funds kind of on their own. And then the gray bars are kind of the county demographics. And you can see that our program was largely responsible for the applications filled out by our Black community residents. Right here, Native Hawaiian and other Pacific Islander, our organizations were largely responsible for those. And we did a lot of great outreach within the Hispanic community. So it just shows that, what we were doing, we hit our intended audiences there. This year we decided to bifurcate the programs. So we have two organizations that are just simply helping with application assistance. We're working with Utah Community Action and with Centro de la Familia to help people really apply for those funds. And then we have 6 organizations that we're working with on community outreach and education, which again, we're very happy to partner with PICTAR again. But these folks are also providing application assistance. The capacity of this program, it's really interesting. I think we're already around 1,000 applications with the 8 organizations that we're working with, whereas last year within an 8-month program, we kind of hit that 1,000 by the end of the program. So the capacity has just ramped up in such a great way. And we're also trying to do more kind of direct outreach with people and with communities, trying to add some, door-to-door canvassing and adding some phone calls and talking to people that we know live in rental units. Like, hey, this is available. If you've experienced a financial hardship, we can help you apply for these funds. We've really tried to structure our program like a 3-legged stool. We're really kind of trying to change our perspective from just providing direct assistance, which is what we've been doing for 15 months, and trying to kind of pivot a little bit from that emergency response to really trying to move us into a recovery, into a recovery. And so we've got our application assistance and outreach peg, which is doing great. We've got our direct assistance peg, which is doing great. And now we're really focused on eviction diversion and housing stability. So we're looking at creating 4 housing stability programs, which I'm really excited about. None of these are kind of fully fleshed out yet, but these are kind of 4 things that we're looking at creating, which is increasing our capacity and our presence in the courts to help people who are facing eviction, also provide some tenant education, looking to provide some sort of mediation emergency fund or along with some case management so that we're helping people, who need case management, but not wasting resources on people who don't need case management. Like I said, we're seeing that seniors aren't accessing this program. So is there something that we can do to help increase the participation from that demographic in the program? And then also there's a lot of interest in the community from homelessness prevention to kind of rapid rehousing and emergency rental assistance, and just there's a lot of interest in a housing navigator and what that might look like. And so these are some programs that we're looking at exploring. I think that concludes my presentation, but I am happy to take any questions from folks in the chat or what have you.
Thank you. Thank you, Lauren. And before we go to the questions, I do want to emphasize something that it's true. What is a community health worker and why is so important or why we're talking about them? I know that, in the health world, most of the people know who is a community health worker, but in the housing world, we're kind of a new entity. And so a community health worker is a leader in the community that, it belongs to the community, it's part of the community, and is a natural leader, generally speaking. They face the same problems as the community is facing. They live the same experiences the community is living. And because of that, they have a direct contact with the community and they understand what is happening. We're kind of the to-go person to get resources, to go person to get, the information or guide people to do things. So there is different names on community health workers across the country and across the world, because we have community health workers in Russia, we have community health workers in South America, we have community health workers in Europe, and so the importance of it, for example, I am a 3rd generation of promotores. My grandma was a promotor. My mom is a promotora, and myself, it's one because they taught me how to do it. In the United States, we call it community health workers, but we have a wide variety of names. But at the end of the day, that's what we do. And that's who we are. We're leaders in the community, even if we feel uncomfortable saying that. We are, and we're the to-go people to receive resources and services, as Susi was saying, as Lauren was saying. And how can we contact community health worker, or how can we, if I need assistance, or if I am in troubles, or we have heard so much that there is people that don't want to help because they are overwhelmed or they have a lot of work. Community health workers, as you heard at the beginning from Susi, we will always, if we cannot do something, we will refer you to another community health worker that we know that will have the same capabilities, that we will have the same heart, that we will have the same experience as we do, to make sure that the person gets connected and get the services that we need. As Lauren was providing and showing in her presentation, as you can review it, I understood at the end of the day that our practices are effective, and we see it in the chart. Our practices and the word of mouth that we provide is super effective. And I want to ask Jakey, because you are here, and I want to hear from you specifically why you decided to call you community health worker and or enter in the housing world or in PICTAR.
Well, I didn't really know what the job was when Susi told me. And I kind of learned what it was like while I was going through the interview process. But like my passion has always been community. I was studying theater at UVU in 2018 and I dropped out to get involved in like community work. From there, I just was in any space that I could be in, different communities. And so I kind of gradually just met Susi on Facebook, and then I saw the amazing work they were doing, and it seemed like another way to take like my activism on another level. And I think community healthcare work is so important because I feel like, especially with Pacific Islanders, if it's not someone that looks like them or understands their culture, they're going to be more hesitant to like accepting that resource. if that makes sense. But so much of the outreach I do is on social media. I see someone post that they got in a car accident. I know that that means that they're going to have to pay a lot of money. So I'm like, we have rental assistance. Or if I see someone tested positive for COVID, I immediately slide into their DMs. And so I think I learned that from Susi, and I think Pictar does that. We are very on social media and on the ground. I've talked to people in grocery stores, at the mall, at movies. Anytime I hear somebody saying something, that's like where my advocate hat comes on, because they might not actually see that resource or that it's an actual thing. And another thing that's been so helpful is building relationships with landlords, with apartment complexes. When I first started like a year ago, it felt impossible to get a client into housing. But now I have relationships with like Project Open, for example. And so their leasing office, they will send me their openings before they actually post it on the market. They're like, hey, if you have any clients that need this. And I think we really have to think outside of the box, because there's way too many barriers for any of these people to get housing. Sure, the rental assistance is great, but when you have evictions from domestic violence, when you have poor rental history because of domestic violence, no one will house them, even if they have a voucher. And so we're having to like think outside of the box, really loving the client and wanting to just see them empowered. And so many of them, like, sure, the application is so easy, but when someone is going through trauma, they're one bill away from being evicted or trying to feed their kid. There's no way they can sit down to apply for rental assistance. And like Susi said, you know, I will always get clients in who domestic violence might be their first need, but really housing is also there. And so we always try to assess like those basic needs, like housing, food, because until we do that, they're not going to be able to like empower themselves, because they're living in this world of like chaos that is dealt to them because of systemic issues. And then I always tell caseworkers, community healthcare workers to show up to city council meetings. I'm sure the city council is sick of me by now, but I will always make my voice heard, because I feel like we have to take our advocacy more than just applying people to rental assistance or giving them resources because the system is broken and just like band-aiding everything. But we really should be showing up and advocating for them. Because, you know, I'm probably one accident away from losing housing. I think our whole staff has utilized ERAP. And so like the people doing it also have that shared lived experience. And so we're able to connect with people. But sorry, that was so long. I like to get on soapboxes. So
no, that's exactly what I wanted to, to hear. I don't think that, I don't know who's watching us, but, I just wanted to make sure that everybody understands, with our own words, what and how we see community health workers and how we see our amazing work, because I do believe that our job is amazing. And I do believe, as you were mentioning, that, our job does not end after 5, and our job does not end, when we finalize an application. As you were mentioning, we identified not just the housing situation of the person, but overall, how is this impacting the person and what is it that we can guide them to do? And I think that that's amazing from us. So if people is listening to us and they want to work with community health workers, Pictar is an amazing organization. We have many other organizations. You can contact us or you can email us and we can provide you or guide you with the different community health workers that, that are around the state, not just in Salt Lake County, which is the amazing part. We also, because we know the importance of resources, we connect with each other, and we will make sure that we will know not just the person who lives around us, but in the entire state. So Susi, you have your hand up. I was
just going to say for people that are here listening, we co-case manage a lot. So there are agencies out there that come across with somebody that speaks a different language, that has a different lived experience. They will call us and say, hey, can you help us? And we will always happy to co-case manage and help teach other agencies the other resources that we know. And so I've loved that we've been able to bridge between agencies, because, you know, if your demographic is not the most vulnerable, but you have someone that walks through your doors, yeah, collaboration is definitely the key. And just wanted to say, if you have that need, reach out to one of the grassroots organizations and say, hey, can you co-case manage with me? And then it's been very helpful and learning for both our staff and theirs. And how do we bridge to really help everyone in our community?
Yeah, Susi, that's exactly right. You end up with the amazing statement, and I'm not gonna say anything else because it's wonderful. It's true. Collaboration is going to be the most important. And you know, Christine, you know, she was mentioning at the beginning that a person might need one caseworker. We know already that because of the pandemic, the person might have 5. And so the importance of connecting us and having, you know, beautiful conversations with each other, or have that relationship in work, is what is helping our community members, and it's what Lauren is presenting with those amazing charts, that we are helping community members. So I thank you so much for this discussion. I would love to have it for an hour or more, but we know that we have to end it. So I am going to transfer the baton now to Franchi, and I really thank you for your time today.
Thank you so much, everyone. I have to applaud Lauren and her little office away from work, and her team in Solo County for the amazing work they did. And that, you know, when they put out the RFP for grants this year, they really listened to the community and what was needed. And I am in absolute awe of the amazing work community health workers are doing in our state. There's one question in the Q&A: how long will the ERA money be available? Well, the last answer that I have from the state is that it can be spent by the end of the year. It really depends, and Lauren, correct me if I'm wrong, but from the state level, the money can be spent by the end of the year, even if legally it could have been 2025.
Yeah, that's correct. I mean, I think right now we have enough funds to get through, you know, the end of the year, maybe into early 2023. We fully intend on requesting additional funds.
Right.
So we'll see where that gets us. But you're right.
All right. Well, and please have in mind that Congress might take action again, right? We don't really know what might happen. And cross our fingers, we'll all be safe because of the pandemic, because we're still, you know, it's still here. So Susi, thank you so much. Jakey, thank you. Christine and Sherri, thank you so much. Lauren, thank you. Appreciate you all. And I'm going to share this information that you have received today.
Thank you all.